Did you know that your muscle mass does more than help you move or lift weights? It actually acts like a powerful anti-inflammatory organ. Meanwhile, excess fat, especially visceral fat, can drive chronic inflammation, aging, and disease. Let's explore the science behind how muscle protects and fat promotes inflammation. Adipose tissue, especially visceral fat, is not just passive energy storage. It functions like an endocrine organ, releasing pro-inflammatory molecules called adipokines. Key pro-inflammatory adipokines include TNF-α, tumor necrosis factor alpha, IL-6, interleukin 6, in excess, promotes liver CRP production. Leptin can have pro-inflammatory signaling at high levels. MCP1 attracts macrophages to fat tissue. As fat mass expands, especially in obesity, the tissue becomes hypoxic, leading to macrophage infiltration in a chronic low-grade inflammatory state. According to Hatami-Sligel et al., 1995, Science, this inflammation is a major contributor to insulin resistance and metabolic dysfunction. In contrast, skeletal muscle is a potent anti-inflammatory tissue when active and well-developed. Muscles release myokines during contraction, cytokines with anti-inflammatory and regenerative effects. Key myokines include IL-6, from muscle, paradoxically anti-inflammatory when released acutely during exercise. Pedersen promotes fat browning and energy expenditure. IL-10 and IL-1 raw antagonize pro-inflammatory signals. Pedersen and Febbraio, 2008, J. Physial, described muscle as a secretory organ with systemic anti-inflammatory effects. When muscle mass is low, sarcopenia, and fat mass is high, we see an increased risk of type 2 diabetes, cardiovascular disease, certain cancers, neurodegenerative conditions, depression. A high muscle-to-fat ratio improves insulin sensitivity, inflammatory profile, lipid metabolism, hormonal balance, immune modulation. Regular resistance training not only increases muscle mass but also reduces visceral fat, down-regulating inflammatory pathways. How exactly does muscle protect us? Improved glucose uptake via GLUT4 transporters, higher resting metabolic rate, enhanced mitochondrial function, reduced circulating inflammatory cytokines. On the other hand, fat accumulation leads to endotoxemia from gut barrier disruption, increased lipotoxicity, toxic fat in liver, muscle, hormonal dysregulation, e.g. low adiponectin, high leptin, inflammasome activation, NLRP3. So yes, having more muscle is not just about strength or aesthetics. It's a powerful anti-inflammatory shield that actively protects against chronic diseases. And reducing fat, especially around the abdomen, can dramatically lower your systemic inflammation. Let your muscles do what they were evolved to do: heal, protect, and energize your body.